You have cancer. Those are words that no man or woman ever wants to hear. But what if you or someone you love does one day hear that from the doctor? What then? I'm Dr. Angela Mosley, and welcome to today's episode of the DocMo Show, where we're committed to bringing you the information you need to feel your best naturally. Today on the show, we have a very special guest joining us, Dr. Felicia Adderley, who is a cancer wellness coach and licensed physiotherapy specializing in cancer rehab and wellness. And she's going to help us answer the question of what happens after receiving a cancer diagnosis, as well as give us ideas, tips, and real strategies to best support ourselves or someone we love, and maybe even come out on top, and possibly even better than before, should anyone you know ever get a dreaded cancer diagnosis. Dr. Adderley is the founder of Adderley Physiotherapy in Nassau, Bahamas, where she helps her clients navigate the overwhelm and emotional turmoil of a cancer diagnosis. With over a decade of experience, Dr. Adderley is an expert in using natural therapy approaches to help her clients manage pain, improve mobility, and enhance their overall physical wellness. Please help me in welcoming Dr. Adderley to the show. Welcome, Dr. Adderley. How are you today? Thanks so much for being here.
Well, thank you so much. I'm doing well, Dr. Mosley, and thank you so much for having me.
Oh, it's so awesome to have you. I think this is an important topic, and not too many people have too many discussions or conversations about it. What do you think?
It is an area I would say that is definitely not spoken about enough. I think in general, yes, persons may talk about cancer, but they don't as much highlight what are the side effects of cancer treatment and what can be done about it. I think we so much of the time think of it as this is something that is happening to a person that they cannot take control of and something that they can't be an active part in their own healing and looking for those different ways and those different people that can actually assist them in having less of a negative effect of the cancer treatment and the whole cancer process.
Absolutely. So, I want to start off our conversation with a question about what you specifically do, because I don't think most of us reach out or think about reaching out to a physiotherapist when we think about cancer. So, help me in understanding this. What is a physiotherapist, and how can someone with cancer benefit from using a physiotherapist?
Yes, excellent question. So, physiotherapists, in general sense, we are these healthcare providers that are going to assist persons in returning to their optimal physical function. So, it really follows well that when persons may have had a cancer diagnosis and they may suffer some losses in their functional level, that's often they may have difficulties walking, they may have neuropathies, many different side effects that they can get from all the different cancer treatments. And we are actually the natural choice for persons to come to and seek us out. And then on top of that, we do also have the specialized training, this certified lymphedema therapist. So you have physiotherapists, as we call it here in my country, physical therapists in the US, also occupational therapists that tend to be, and I believe also even massage therapists can get this designation of certified lymphedema therapist. And that gives us specialized training to help and deal with lymphedema, which is one of the many negative side effects that can occur even several years after cancer treatment. And it's definitely an area that is just not spoken about enough, even even in the medical community. And it's still very shocking to find out patients come after the fact and they more than often say they didn't know that this could happen to them and they had never heard of it before. They don't know what it is. And that's where we come into play. But we would really love to get in contact with the patients much earlier in the process and in the cycle. We actually want to be there very soon after the you have cancer statement or conversation. We want to be able to get in there and help them earlier in the process so that we can avoid some of these negative side effects and give cancer survivors the strategies that they need to make it as smooth of a process as possible.
Mm. So it sounds like getting involved earlier with a physiotherapist helps to have a better outcome. So tell me more about this lymphedema because, I know what it is being a physician, but some of the listeners may not know what that is. Can you describe what lymphedema is? How would they feel or how would they know if they have something like that?
Yes. So lymphedema is an accumulation of protein rich fluid in the tissues. And the reasoning for that is because usually with cancer treatment, there may be some part of the lymphatic system that is removed. So often that is lymph nodes that are taken from an area that may have been compromised by cancer and tumor growth. So those are going to be removed. And then when you take out a part of the system can easily become overwhelmed. And then that filtration that's supposed to occur and take that protein rich fluid out of the tissues then is hampered. And then persons start to get a limb, usually an arm or a leg, but it could also be the head and neck that start to swell. And what happens for a lot of persons, it can be very subtle at first. Maybe their clothing starts to get a little bit tight, like the sleeve of a shirt or a dress may start to get tight, or they may notice what feels like a heaviness to one of the limbs that would have been affected. And it's usually those little changes. It's not usually very noticeable at first because it is something that tends to come on very gradually. And also in the early stages, it will swell and reduce spontaneously, particularly overnight. So persons tend to think that it is not an issue or not recognize it for lack of knowledge of what the signs are. And then when it comes to the stage where it's no longer spontaneously reducing, then oftentimes that is when the cancer survivor would then mention it to their oncologist, and then usually they would identify that and then make appropriate referral.
Mm-hmm.
But that is generally the process of what would occur with lymphedema. And unfortunately, because the awareness is so little, persons don't know, cancer survivors don't know what to do to reduce their risk of getting it. And also, what are the signs to be looking out for in case they do, since it is a progressive disease and it won't go away. So if they can get it when it's at an earlier stage, it's almost like cancer early detection saves lives. But in this case, early detection saves you a lot of trouble. It's not a life threatening condition, but it is life altering, I would say, to be sure.
Absolutely. And I mean, it's interesting that you mentioned that the majority of the symptoms can even pop up overnight. You might have noticed some, low level symptoms or low grade symptoms at first, but then, it's like, well, where did this come from overnight? And like you were saying, it doesn't just go away on its own. And I think a lot of people get caught in that trap where they think, oh, my foot is swollen or my arm is swollen, it'll go away. Let me just wait and it'll go away. And it sounds like you're saying that doesn't always happen.
That's correct. It is known to be a progressive disease. So once it begins, it's just going to move from stage zero, which is that latency phase, and it's just going to keep going if it's unchecked. So the thing with lymphedema and lymphedema treatment is that it's all about management because it's not going away.
Mm-hmm.
You can't be cured of it. It's something that a person then would have to live with for the rest of their life. And so they have to learn the strategies in order to maintain that condition until, that happy day when a cure is found. We have hope. I always have hope. So for the time being, there is just management. So what persons generally will do, they will come to us. We will do uh, some management in the acute phase and also be teaching them. It's a lot of patient education is one of the cornerstones of lymphedema treatment. And we're teaching them what they will need to then do moving forward. because there will be an intensive phase where they will be coming into the clinic several times a week and getting this treatment so that we can get an immediate shrinkage of that joint. That limb we wanted to reduce in size. And once we get them to the end of that intense phase, then we do look for them and seek for them to have the tools to be able to carry on that treatment on a daily basis. A simplified version, but on some level, they will have to self treat because it's lifetime. And then the idea is that we will check back in with them at intervals to make sure that they are still being successful with self management, that they have the correct fitting garments, that their bandages are still in good condition if they need to be replaced, and we're ordering those things for them. And generally, we're following along the same way that they would follow along with their oncologist as a part of their healthcare team to be sure that there is no reoccurrence of cancer. Then we are doing the same thing. We are making sure that their lymphedema is adequately being managed so that it is not going to continue to progress through the stages.
Mm. So, is this something that anybody who gets a cancer diagnosis needs to worry about? I mean, are there particular cancers that are worse or more prone to getting lymphedema?
It really depends on what the treatment was, to be quite honest. It depends on things such as how many of the lymph nodes were taken out. And I would say those persons are going to be more susceptible. But it can be from breast cancer, it can be from even persons that have had prostate cancer, it can be from persons that have had even cervical cancer. It depends more so, once again, on whether or not there was any part of the lymphatic system that was either surgically removed or perhaps it was affected by radiation. And if that occurs, then they may be susceptible to getting lymphedema. But not everyone gets it. It's only a certain percentage of persons that would get it within a year to 2 years after cancer treatment, initial cancer treatment. But it really depends on what types of treatment they had and where lymph nodes were taken from, where radiation may have affected. That is more of the deciding factor.
Hmm.
And then also what they do after that, because some persons don't know what are the things that they should be avoiding doing that could trigger the lymphedema from developing as well.
Ah, so it's like you said, it goes back to really education to create a lifestyle to minimize that swelling and discomfort that may happen after the fact after certain cancer treatments. So tell me a little bit more about what is lymphatic massage? Like, how is it different than regular massage? And you did mention that even a massage therapist can get trained in this particular technique because I'm sure some people are like trying to cut corners and like, well, I could just go to my regular massage therapist. But it sounds like it requires a little bit more training and education in order to know how to address the lymphatic issues that may occur.
Very excellent point. And I always encourage persons to do their due diligence, do your homework, look at what are the credentials that a person would have. You would want to make sure that it's a person that has taken the time to qualify themselves. And you're correct, persons do feel that, maybe I'll just go to the massage therapist and let them press on it. And I think that that will be good enough. However, it's not a regular massage. So manual lymphatic drainage, as we would term it, is it's a series of light strokes. So first of all, if someone is really needing you very, very deep, that's not a proper manual lymph drainage. And there is a knowledge that is going to be needed. The theory about the anatomy of the lymphatic system is very important because it's not a regular massage. It's not enough to just rub or move. You have to know how to open up the flow, the areas where the flow needs to go, right? Because there's a rerouting that needs to occur of the fluid because there is either a blockage in the system or there's a part of the system that is damaged. So it's not going to work to just rub, okay, without opening the channels, okay, because you can think of it almost as like a dam, water that is trying to flow, but there's a dam that is slowing it down or stopping it. So if you don't open up the dam, it can't flow. So it's very important to actually have a knowledge of the lymphatic system and to get that specialized training, because they don't teach it to you. Even in regular physiotherapy school, it's not a part of the regular program. It's something that you have to do as continuing education after. At least at the time that I went through school, it was not. So I would advise persons to do their due diligence and be looking for designations like MLDC, so that's like MLD certified, or CLT, which is certified lymphedema therapist. And they have to have something, because other than that, they won't really be effective in that treatment. So I would say just be looking for those designations. And I would say that most persons, when you go into their establishment, would have, their certificates hanging on the wall. Of course, you have also the internet that you could go to. I know persons tell me, I've had a couple of patients tell me that they Googled me before they came, which was somewhat surprising to me. I'm like, people do that? But, I was like, oh, okay. So, there are always ways to find out. Or you could, if you're comfortable, you could simply ask them, if they are trained in this area of specialty, so that you know that you're getting the best possible treatment, care, so that you can have the best outcomes, because that's very, very important. So, yes, you have a number of, and I believe there are even some physicians that have trained in CLT. So, there's mostly almost any healthcare provider and also massage therapist, it's appropriate that they can go and do this training so that we can always give our patients the best. So I would say those are some of the things that you would want to look out for, but it's always a telltale if you're being needed very, very firmly, if it's very deep, like they're trying to knead your muscles, because the lymphatic system lies just beneath the skin and you don't have to knead to get there. Okay, so it's a very gentle series of strokes. So that's always a telltale sign there.
That's really good information. I've never had a lymphatic massage before, so if I go to the masseuse, it's like, yeah, give me deep tissue. So that's helpful. I think for people to know that the lymphatic channels are really shallow to the skin, so it doesn't take a lot of pressing and pressure in order to get the effect, but it does take that understanding and competence to know what you're doing to get the effect, like what you're saying.
So true. And I would say the other distinction is that when you do a manual lymph drainage on someone that has a healthy lymphatic system, as opposed to someone that has a defective lymphatic system, it's actually a little bit different because you don't have to do that rerouting. So it's still, and there are different trainings. So I've done some trainings. I've done 3 different trainings, and one of them was for more towards persons that have a healthy lymphatic system, and I was able to compare the 2 courses because it didn't have that extra information about how to reroute the fluid around the damaged part of the lymphatic system. So, manual lymph drainage is still appropriate for persons with a healthy lymphatic system that, let's say, for instance, they have had liposuction or they have had rhinoplasty, so that they can get those nice results as well. The BBL is very popular these days. So, that is another reason that persons seek out to get the manual lymph drainage. And so it's a little bit different, the sequencing, because there's a part of it that is not necessary to reroute that fluid. So it's very important to know that the person has had not just not just that training that's appropriate for persons with the healthy system, but that they've had the one for persons that have a defective lymphatic system as well.
Awesome. So, what I want to know is how did you come to realize that individuals dealing with cancers needed this type of care and service? Like, what caused you to be passionate about it and want to help these types of clients?
I do believe that I'm just a person that, at my very core, I just want to help others. In my country, we have a very high incidence of breast cancer. It has been the source of research studies here and doing lots of gene testing to see if persons have the BRCA1 or BRCA2 gene. We're not quite sure what it is, if it's environmental and what it is in the environment that may be contributing to these increased numbers of breast cancer here in our country. And as a teenager, seeing that and then going to college in the US and deciding that I wanted to, be a physiotherapist and then filtering around to my different clinicals. I came into contact with a clinical instructor that was a lymphedema therapist and I latched onto it then and I was like, wow, like I could really help the Bahamian people with this. This is something that we need. We have so many people that have cancer and not really enough people that are specialized to service them.
Mhm.
And that's what I really took hold of. And start to hear, even now as a clinician, I hear the same story again and again. I didn't know this could happen to me. I didn't know this was, a thing. I didn't know what to look out for. I didn't know if there was a way I could have prevented this. And it's what continues to drive me so that the message can actually go out to the people that need it and that they can get the help that they really require. I do feel like a lot of persons, it slips through the cracks. I think what happens is you hear you have cancer, and a lot of the times, like everything goes out of the window aside from let's get rid of this active cancer, right? And let's try to get this person, save their life, and get them back to a state of as near wholeness again as we can and healthiness. So I think a lot of the times the other details get very lost in the shuffle. And what I would wish for so many more cancer survivors is that they could get the information so much earlier in the process so that a lot of these things are not falling to the wayside, so that they could know, well, hey, what's a better way that I could eat, even so that my treatment, my cancer treatment, isn't as brutal. What are the tips that I can put into practice? What are the things that I should avoid doing? If people can get that information early on and feel like they even have someone to hold their hand and walk them through the process, somebody that is really with them every step of the way, someone that's there consistently, and it would make, even on an emotional level, I think that it helps them so much. So, and to not feel like just another cancer patient, you know to know that they matter and that they're not alone in the entire process. I think that it's crucial, and that is how I came to put all of this together and forge ahead as a cancer wellness coach. So
That is
that's
phenomenal. So you describe yourself as a cancer wellness coach, and you just mentioned, other things that people can do as they're going through treatments to help themselves to feel better. So, is there more than lymphatic drainage that you do? Is there like you mentioned nutrition? Do you give guidance on those sorts of things?
Yes, that's correct. So I would have some recommendations that I would make for persons that have been recently diagnosed with cancer. They would want to make some dietary changes, even right down to, making changes in their environment. For instance, things like, the type of detergent that they use to wash their clothes with. Sometimes we don't think about what are all the things that we could be doing that are actually increasing our risk of cancer. So that's important really for all of us. because we want to avoid getting cancer in the first place if at all possible. We want to do our part, everything that we can. Of course, there is that genetic component. However, there are definitely some things that we could do as individuals that could reduce our exposure. So those are the things then that a cancer survivor, usually they have a heightened awareness that they want to make changes so that it doesn't reoccur. And those are the kinds of things that I am able to assist with, give them that counseling about, nutrition, exercise and activity level, which of course is again up my alley as a physiotherapist. Okay, always exercise is a part of everything, right? Exercise is almost always the answer. And of course then also assisting them with any deficiencies or shortfalls that may occur physically as they move through their treatment. Again, if they have those neuropathies or they may have reduced endurance, those are the kinds of things that are naturally a part of what I would do as a physiotherapist for any diagnosis really. And of course, to assist them in just trying to get back to prior level of function, preserving as much of their quality of life as they possibly can, and overall reducing the chance of recurrence of the cancer.
It's awesome. Now, what I wanted to ask you about next kind of relates to what you were just talking about, because I think that many cancer survivors are a little bit hesitant to look for, seek out natural therapies and approaches because, they've been told and they may have been kind of coached that it may interfere with their conventional treatments with their oncologist. And so, do you run into those types of concerns? And if so, how do you address that sort of fear with your client? And, how do you overcome that hurdle so that they can get the most support that they can get for their recovery?
Yes. Well, the best thing to do is to approach it as being a part of a healthcare team. It's a team of professionals that are trying to get the best outcome for the patient, keeping the patient at the center of it and really making them the top priority. So it's not about egos, it's not about who's right, who's wrong, it's not about who knows more than the next one, who has been doing this for 30 years, you know, because we know a lot has changed in 30 years in any event. But I would definitely I always encourage patients. It's not like a going rogue and we're over here in our corner and we're doing our own thing and then the rest of the healthcare team is over there somewhere. So I always encourage them to loop in their oncologist, and to whenever they have a visit with them, I said bring this up and see what they have to say about it, get some feedback from them, see if they are in agreement with that. And we always want to be respectful, of course, of one another as healthcare providers. And so if I can get their oncologist on the phone and say, what do you think of this? Then that's definitely an approach I would like to take as well. I also encourage my clients to do their own research from reputable sources so that they can see for themselves. I never make anyone take my word for anything, I just be like, you can actually look that up, for yourself. You can look it up, and you can come back and tell me what you found. So I think that can help and allay some of a person's fears, and they can feel a bit more assurance that what they're getting is something that is safe for them. It won't harm them or make them any worse, and that it's something that actually could really help them and they could benefit from it. So those would be some of the ways that I would seek to do that.
That's awesome. Like, I love it because, like, you create this integrative network of people who are all there to help the person get better and recover. So I really love that, to be more inclusive instead of exclusive, and really encouraging them to include their entire team in the process. I love it.
Yes, that is essential because we have to remember that it's not about like us as the healthcare providers, it's about the people that we are trying to help. So we have to keep them at the center of it all and keep their best interests at heart.
Absolutely. So, for someone who has never tried physiotherapy before, could you describe some of the potential benefits they can expect from a session with a physiotherapist? Like, what do they expect when they go? Like, what should they be looking for? How should they feel? What's going to happen afterwards?
That's such a good question. And I made a little video, a very brief video that I send to my clients before they come to their first visit, because I know that that's another thing I recognize is that people don't know what to expect. And, even for persons that are coming for other diagnoses, some people still think that they're just going to lay there and get a massage. Like, get ready. You are going to do some work. So it's usually a rude awakening when they come to this office for sure. Because although we do usually have a very good time, that is one of the things that will definitely be involved will be exercise, because it's so important to help us to strengthen. The strengthening is so important. Okay, so basically what we then would do, we're here to help people with things like pain management, because that is always the number one reason when it comes to some of the other diagnoses. Most people only go to the doctor when they have pain or they have a problem, and that's why they end up here. So when I ask that question as a part of their assessment, it's like, well, okay, what is it that took you to the doctor? Oh, I was in pain. If it doesn't matter what else might be happening, but if they have pain, then they will present to the physician or the healthcare provider. So that's one of the things that we deal with is pain management. And aside, lymphedema is usually not a painful condition. So that's one good thing. We also deal with things like gait training, because persons may have had a loss of function for different reasons and they are not walking normally. They may come here, they may be on crutches, they may be in a wheelchair, but it's a condition that's meant to be temporary. So we assist them in getting back into the proper strength, the proper and normal range of motion, or at least a functional range of motion that they can then get back to quote unquote regular life. So those are the kinds of things that we deal with. Like in general, those are the categories that we'll be looking at when patients come to us. We want to educate them. We want to improve their endurance, improve their strength, improve their range of motion, and overall improve their function so that they can get back to their normal or daily life.
Mm, I like that. That's so awesome. I'm like, it sounds fun. Like it sounds like anybody could go at any stage. You don't have to be suffering from something in particular to go and enhance and optimize your life and kind of your physical condition.
So true. And I do wish that more people would take that approach, because it is definitely prevention. We do have a lot of, let's say, even for athletes or someone that plays golf and they need to they want to improve their swing. Then we would know what are the muscles that need to be strengthened. What are the muscles that they need to improve their flexibility in? And those are the kinds of things that we deal with. How can they prevent injury? The thing is that most people wait to come to therapy until they are already injured, when we could have helped to prevent that in the first place by just giving them some strategies, telling them what to focus on with the strengthening, and even overseeing some of that process. Because physiotherapy is really a discipline that is about getting to independence. We are not a discipline that seeks to keep people coming back for the same thing over and over. And we are all about independence. So we're trying to get you to as far as we can in the process, because we know that there are limitations financially and with insurance and all of that. And so we're trying to get you to a certain point, and then we are going to give you your instructions in your home exercise program. And it's fly, little birdie, fly. I'm here if you need me, but this is for you to now take in the hand and move forward, because it's supposed to be a lifestyle change, right? This is how you're supposed to live going forward. This wasn't a one-off, one time, 1 month process. This is supposed to really be life changing, and you take this and you move forward with this. So that's one of the things that I think I like about being a therapist. It's not predicated on a person coming back over and over for years for the same thing. The lymphedema is a little bit different because it's a lifetime issue or disease at this time. But even that, it's really only every several months the patient would check in. And once they're fine, we give them what they need. And again, it's fly, little birdie, fly. I'll see you in a few months.
Yes, I love that philosophy because I take the same approach even in my practice as a functional medicine doctor. The whole point is to get you over the issue, get you functioning optimally so you can live your life. It's not to stay in the doctor's office from now on. That's not a life or not one that most people will want.
Right. And that is essential. It's so essential to capture that we want to take care of our bodies in our youth, so that we and have good mindset toward health and wellness, so that we are not in our latter years spending all of our time just in and out of doctor's offices, pumped full of medication, can't enjoy anything, can't move, can't do anything for ourselves. What kind of life is that? We want to retain as much of our independence and our function, and even we want our minds to be there. We want our cognitive function, and we want to live really and truly, although I think this statement is overused now, live our best lives straight up until the end of our years. We want to live long, healthy years, and it's so important to take care of our bodies in our youth so that it takes care of us when we get older as we age, and we're not spending the rest of the latter years in and out of hospitals. I'd rather be spending it walking in and out of the airplane and making those trips and enjoying life and still being able to see and do and move and experience. So that's really my wish for people, is that they would truly be able to live long and live well.
Yeah, I love it. I'm like that. That's what I want my end to be: living long, living well, dancing when I'm 100. It's like that's the life I want.
Mhm.
To be able to function and do and not be in pain, not have all these chronic issues moving forward. Um, so I wanted to ask you, because this sounds like a pretty personalized journey when you're working with clients. So how is it that you develop a personalized physiotherapy plan that really addresses their unique needs and their goals? And what factors do you have to consider when you're creating a unique plan for someone?
Very good question. So this is where the assessment comes in, and that assessment or consultation, whatever a person would prefer to call it, that's where we're going to take that very detailed history. We're going to get into what a person's daily routine used to be like. We're going to also uncover what is that person's goal. What are their patient goals? What are their goals with therapy? I usually term it as this: what do you want to accomplish by the end of this process? And that has to be taken into consideration because the client or patient has to be, again, at the center of it. There has to be that buy in. What they want has to be taken into consideration. So that's how I would start to then develop that. And then I would set some goals for them as well, based on what I see, whatever the deficits may be. And you have to somewhat, because there could be a lot, you have to somewhat prioritize. Well, okay, what are we going to work on for a second, third, fourth, and down the line? And then you line them up and you knock them down. So that even comes into a bit of a from the health coaching perspective. That is really how it is done, because a person could have many different things they want to work on. It's like, well, I want to get my nutrition together. I want to change my diet. I want to change what I use on my skin, what I use on my hair. I want to be more emotionally well. I need to manage my stress. I need to improve my relationships. So that's where more of that coaching aspect then comes in. So all of those things need to be taken into consideration and put together. And you're right, it's very personal. It's not going to be the same for each and every person. And so it's really, when it's that one-on-one, it would be different in a group setting. But when it's that one-on-one, that's what they're really signing up for, is to get a personalized care plan that is going to help them to reach the outcomes that they would like to see.
Mm. I mean, that sounds really amazing. So, in your experience, are there some common misconceptions that people may have about physiotherapy? And if so, how do you dispel those? What are people thinking? You already said they think they're going to come in and just lay down and get a massage. Are there other things that people have in their mind that they're expecting that just isn't the case?
Yes, I would say the main thing is that they think it's going to be very painful. They have some names that they call us that I will not repeat here on your show. And, they think it's going to be horrible. So many times they have that first visit and they leave. And at the end, as they're leaving, they say, well, that wasn't so bad. Or that wasn't as bad as I thought it was going to be. I'm like, no, it's really not. And you mentioned something earlier. Usually it's actually a lot of fun. And by the time my patients get to the end of the process, many of them are saying, I really enjoyed this. I have to say, I enjoyed the conversations and everything. It's a whole, and you really have to have, as a clinician, and I'm sure that you know this, that there is that thing where you want to have that rapport. You want to be professional, but you want to also be personable. And that will it makes everything better. I almost believe sometimes that they come just as much for the conversation as they do for the treatment, because it becomes healing and soothing to them as well. The atmosphere has to be right. And there is something to be said for really having a healthcare provider that you click with, for lack of a better word at this time, and somebody that you're comfortable with, so that when you come, you really feel like you're in an atmosphere where you can get everything that you need, not just from that technical sense, but people need a lot. They don't only just need the technical skills that we have. They need that reassurance, they need that listening ear, they need a lot from us, and they get a lot, right? They get a whole lot from us. It's not just a treatment. The therapy is usually regular therapy is usually an hour. When I see a lymphedema patient, we're closing in on an hour and a half, 2 hours. So it's a labor. It's really a labor of love even. And it's something that people, they enjoy it a lot of the times, even though it's not maybe a very happy reason that they came because they were in pain or they had some other problem. But somehow that can turn around and they actually find it to be a very enjoyable experience. I would say at least 99% of the time. Even if I usually tell them, well, if we do something and it causes you, I don't try to use the word pain, I say discomfort. If it causes you some discomfort, I'll do something to make you feel better before you go. you know so we do some sort of pain control, something relaxing. They very often call it their me time, because I think a lot of the issues that people have underlying is that stress that's really there, that causes them to have a lot of these lingering issues and recurring issues. And it's that would be, I would say, overall, that they think it's going to be an unpleasant experience, and they're usually pleasantly surprised.
That's nice. I love it because, you're right. You need that personality coming through and that personal connection with your clients so, they can really get the most benefit because like you said, it's not just a drone robotic type, interaction that you want to go through. We're all people and it just makes life better and easier to deal with when you can connect on your dots or on a more personal level.
So true. It makes all the difference. And it's the difference. I call it big box PT. There's a difference when you go to the big box PT and maybe when you go to something that has a homier atmosphere where you feel more like family or friend, or, like you have more of a connection rather than a nameless, faceless company or corporation. I think but it depends on the person. Everybody has to know what's right for them. I know that some people might like the big box chains or, anything, something like that. But you have persons that are looking for a more personal experience. And I dare say that that is what they would get with me at Adderley Physiotherapy.
That's fantastic. So, is there anything that you want to leave our listeners with? Any final thoughts about if they are on the fence about should I do physiotherapy? Should I not? Should I reach out to somebody? I mean, what should they do at this point?
They should definitely go ahead and do the therapy. My vote is always for the therapy. I feel like you almost can't go wrong with the therapy. Like it's a sure thing or a sure win. Physiotherapy is looked at as a conservative treatment method for so many ailments and diagnoses. So it's always a very good choice for a person. And this could be anyone with any ailment, let's say even back pain. It's always good in my book, and of course I may be biased as a physiotherapist myself, but it's always good in my book to go the conservative route first and try some therapy before jumping straight to surgery, because you don't know what if you can avoid having the surgery altogether. And even if the person still has to have a surgery, they would actually be at a higher point. So if they were here, doing the therapy would get them here with strength, function, range of motion, so that now when they get the surgery, they're not starting from here or even lower. They're actually already here and able to just keep moving and going towards basically their return to function. So my vote is always going to be just do the therapy and, get all of the wonderful benefits that it has to offer. So that's always my vote. I always think a person should at least give it a try. Try a few sessions and see if it does anything for you and you feel some improvement.
That's excellent. Dr.
Mhm.
Adderley, thank you so much for being here today and sharing so many new insights with us. I mean, this has really been wonderful and educational and even eye opening for myself.
Wow. Thank you so much for having me. I really and truly enjoyed it.
So, if people want to know more about natural wellness support during cancer treatments and physiotherapy and lymphedema massage, where can they find out more info and just more info about you?
Wonderful. Well, I do actually have a freebie for the people today, and this one is the 5 mistakes that breast cancer survivors make post mastectomy and what to do about it. Okay, and they can find that at bit.ly/breast cancer mistakes, bit.ly/breast cancer mistakes. Now, where they can find me almost on every social media platform online, but most definitely check me out on Instagram at I am Dr. Felicia, at I am Dr. Felicia on Instagram. I'm on Facebook as Adderley Physiotherapy. You'll also find me on TikTok, on YouTube, everywhere as at I am Dr. Felicia. So you can't go wrong. I'm there and we put out information on a weekly basis around cancer related topics, lymphedema. So be sure to give us a follow, look me up. Okay, I would love to have you all be a part of the community. And let's help and get this message out to the people that need it.
That's wonderful. I put your link down on the screen so everybody can follow it, the bit.ly/breast cancer mistakes. So hey, you got the link. We'll put it in the show notes too, so you can go to it and have access to that. So I hope everyone enjoyed today's episode. And like I said, you can find out more about Dr. Adderley in the show notes. We put the links there. Go there, grab the free guide that she put together for you about the top 5 mistakes that she sees after a mastectomy for breast cancer and how to avoid those mistakes. We want to thank Dr. Adderley so much, and I want to thank you so much for tuning in today. As always, I want to hear from you. So if there's a natural wellness topic that you want to know about, and if you want to stay connected to the community and get some cool freebies, head over to the DocMoShow.com to join the conversation. And be sure to join me next week as we continue to explore ways to help you feel so much better naturally. So until next week, this is DocMo. Stay well, everyone. Bye-bye.